Imagine waking up one day and finding out that the health insurance you relied on for years is being cut. Maybe not immediately, but soon. The U.S. Congress is considering legislation that would reduce Medicaid funding by hundreds of billions of dollars, roughly 13% of its budget. That's not just numbers on a spreadsheet. That's real-world impact. Lost medications, canceled doctor visits, hospital closures, and vulnerable populations left scrambling. The justification being thrown around is a classic trio: fraud, waste, and abuse. But when you dig deeper, it becomes clear that the fallout from such cuts goes far beyond cleaning up inefficiencies. On social media and in political discussions, you'll often hear the argument that the cuts are simply about cracking down on people who shouldn't be receiving Medicaid, particularly undocumented immigrants. But if you actually read the laws on the books, U.S. Code 1611, the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, and the U.S. Citizenship and Immigration Services, USCIS, eligibility policies, it's already crystal clear. Undocumented immigrants are not eligible for Medicaid, unless it's for emergency medical care, like a car accident or a heart attack that lands you in the ER. Federal Medicaid funding cannot be used to cover care for someone who is in the country illegally. And that emergency care exception is rooted in a basic human and ethical reality. Hospitals can't and shouldn't refuse to treat someone bleeding out or suffering a heart attack because they don't have the right paperwork on them. That said, a few states have chosen to provide limited health care coverage for undocumented individuals, but that comes from state funds, not federal Medicaid dollars. That's a decision made by those states, and it ties into the idea of states' rights, which ironically is often brought up by the same political voices now demanding federal cuts. So if the law is already clear and enforced about who's eligible, then who exactly will be hurt when these Medicaid cuts go through? The answer: everyone else. Medicaid isn't just for people who don't want to work. The majority of Medicaid recipients are working adults, children, seniors in nursing homes, and individuals with disabilities. In fact, many people on Medicaid hold down multiple jobs. They work at fast food chains, gas stations, grocery stores, and small local businesses, places that often don't offer affordable health insurance. It's not uncommon for someone working full-time or even 2 part-time jobs to still qualify for Medicaid because their wages just aren't enough to cover private insurance. There's also a broader economic issue here. Many billion-dollar companies employ people who rely on Medicaid and food stamps, instead of those corporations providing health insurance to their employees. Taxpayers foot the bill. That's not people gaming the system. That's corporate welfare. Now let's talk about what these cuts will actually do. If you've got 100 people on Medicaid, maybe one person is gaming the system, or maybe not. But by cutting 13% of the funding, you're not just removing that one bad apple. You're cutting off 13 people. And since the vast majority of Medicaid recipients are eligible and in real need, that means real harm. And even if the argument is, we'll just do more reviews to make sure only the right people are getting help, that brings up another issue: bureaucracy. Right now, Medicaid recipients go through annual recertification. Under the proposed changes, those reviews will happen twice a year. But Medicaid offices across the country are already underfunded and understaffed. They're struggling to keep up with once-a-year reviews, doubling that load without doubling the staff or simplifying the process. That's a recipe for chaos. When these increased reviews hit, more people will be dropped, not because they were ineligible, but because of missed paperwork, lost documents, or processing errors. This has already happened. During the COVID-19 crisis, the government paused Medicaid disenrollments. Once that pause ended, an estimated 20 million people were kicked off Medicaid. And later, it was found that about 75% of them should not have been dropped. They just missed a form, or the form got lost. They didn't stop being poor or sick or disabled. They just got caught in red tape. Now apply that to someone living paycheck to paycheck. Say a grocery store cut someone's hours. They're trying to figure out how to pay rent, buy food, and cover their kids' school supplies. In the middle of that, they're also supposed to complete a mountain of Medicaid paperwork, track down copies of income statements, and hope nothing gets lost in the shuffle. And if something does, they lose access to asthma medication, insulin, arthritis treatments. Their only option becomes the emergency room, which is drastically more expensive for both the patient and the system. And it's not just individuals. Hospitals, especially in rural areas, rely heavily on Medicaid reimbursements to stay afloat. If those funds vanish, hospitals will close. We've already seen this in parts of the country where rural hospitals have shut their doors, leaving communities without emergency care within a reasonable distance. Combine that with automatic Medicare cuts triggered by budget rules, such as the pay-as-you-go or PAYGO law, and you're talking about a dual financial hit to hospitals. And it's not just individuals. Hospitals, especially in rural areas, rely heavily on Medicaid reimbursements to stay afloat. If those funds vanish, hospitals will close. We've already seen this in parts of the country where rural hospitals have shut their doors, leaving communities without emergency care within a reasonable distance. Combine that with automatic Medicare cuts triggered by budget rules, such as the pay-as-you-go or PAYGO law, and you're talking about a dual financial hit to hospitals. Russell Vought, who's likely to oversee these cuts, has already laid out his plan in Project 2025, a conservative policy agenda that explicitly aims to slash safety net programs. The cascading effect hits nursing homes, too. Medicaid is the largest payer of long-term care in America. Elderly individuals in nursing homes often rely entirely on Medicaid to cover their room, board, medications, and daily care. With staffing already thin and facilities struggling to meet basic needs, additional paperwork and funding cuts will worsen conditions and lead to people falling through cracks. People who are too old, too sick, or too isolated to advocate for themselves. And don't forget the parents trying to keep their kids covered. Pediatric care, mental health services, vaccinations, and dental care, much of it is accessed through Medicaid. But if a parent misses a form or an eligibility worker makes a mistake, that child loses care. Again, not because of fraud, but because of bureaucracy. There's also a tiered structure to Medicaid. Some recipients are in programs that not only provide health care, but also help with premiums and cost sharing for those on Medicare. These include programs that pay the monthly $185 Medicare Part B premium. When someone is mistakenly downgraded or dropped, that premium gets taken out of their Social Security check, often without warning. For a low-income senior, that's a huge hit. And if they can't pay, they lose Part B entirely, which affects their access to doctors and medications. Dual-eligible seniors, those with both Medicare and Medicaid, often have Medicare Advantage plans that give them grocery cards, transportation to doctors, and other extra benefits. Cut their Medicaid, and those benefits disappear too. These aren't people abusing the system. These are people who are barely making it as it is. Some might say, well, it's worth it if we can get rid of the waste. But is it worth it to let thousands of eligible people suffer just to maybe root out a tiny number of ineligible ones? Especially when we know from past experience that the overwhelming majority of people cut in these fraud and waste crackdowns were eligible all along. This brings us back to the politics. If you're convinced this is a good idea, call your representatives and let them know. If you think this is dangerous and misguided, they need to hear from you too. This isn't abstract. It's about whether a child gets antibiotics, whether a diabetic gets insulin, whether a stroke victim gets rehab, or whether a senior gets to stay in a nursing home instead of being dumped into homelessness. Fraud, waste, and abuse should always be targeted, but not with a sledgehammer that hits the most vulnerable. There are smarter ways to audit and improve the system without kicking millions off care. Let's be honest. If this were truly about waste, we'd be looking at the companies profiting from underpaying workers and shifting their responsibilities to taxpayers. Instead, this plan shifts the burden to the sick, the elderly, the working poor, and overworked Medicaid staff. It's not just bad policy, it's cruel and self-defeating. Healthcare should be a ladder, not a trapdoor. And cutting Medicaid by 13% while pretending it's just about cleaning house is like tearing up the foundation because one tile is loose. If you want to fix something, fix it, but don't break everything else in the process.